It was a busy day for wildlife officers. They got news that a baby elephant who is showing uneasy behavior with swollen mouth has been wandering around the village border from a few days. The villagers noticed that he couldn't ingest food properly. They observed that some of the grass he took from the trunk dropped when it reached his mouth. The sympathetic villagers, worried about the elephant, gave the news to the nearest Department of Wildlife Conservation Center. They reached the place immediately to see how they could help the elephant. Soon, they could locate the elephant hiding among the thicket near the village border. Observing the elephant from a distance, the veterinarian guessed that the elephant had fallen victim to a horrific jaw-exploding trap. Before approaching the elephant, the veterinarian decided to sedate it using a tranquilizer gun, as they need to get very close to the elephant to examine it. They successfully darted the elephant, taking the correct aim. The elephant showed an anguish reaction when the dart hits its body and turned around, but soon he was showing signs of losing consciousness and immobilized in a standing position. The vets hurried toward the elephant and began inspecting the injury. Their assumption was correct. The elephant had fallen victim to a jaw exploder, also known as explosive bait. Luckily, its jaw was not shattered by the explosion, but its tongue was damaged and its mouth seemed to be infected due to the injury. Unable to ingest food properly, the poor baby must have been starving in the forest. It was certainly a wise decision to come into the vicinity of humans to seek help in healing the injury. The veterinarian started cleaning the injured mouth. Saline solution was dripped to the mouth using a syringe. Now the veterinarian is washing off the mouth with saline to clear away the dried blood and remove irritants and bacteria. Then, using sterile cotton swabs, he started cleaning the mouth. This is done to remove the dead and infected tissues inside of the mouth. If not, it could even lead to a painful death. Then the injured area was carefully rinsed with povidone iodine solution. This will kill the bacteria inside the mouth and stop the infection and heal the injury. In the meantime, as the animal looking so frail and starving, they decided to administer saline to the elephant. After a thorough cleaning of the ear flap, an IV line is connected to transport saline to the elephant's bloodstream. Meanwhile, another team of officers were busy with administering necessary medicines needed for the recovery of the elephant. The elephant was injected with antibiotics, painkillers, and multivitamins. These antibiotics will prevent spreading of infection, causing microbes and kill them. Multivitamins will provide support to replenish the energy levels, and the painkillers will deliver an anesthetic close to the particular nerves in the brain, interrupting nerve signals that register pain. The veterinarian proceeds cleaning the injured area with povidone iodine solution once again. After a proper cleaning, Metro gel is applied on the injured area. As all the initial treatments were provided, the veterinarian administered the revival drug to the ear vein of the elephant, as it is not wise to keep a weakened elephant sedated for a long time. Even after administering the revival drug, the dedicated officers were holding the IV line to provide a nutritional supply to the weakened elephant as long as they could. The poor animal was injured due to horrific jaw-exploding traps. These are improvised explosive devices that detonate when bitten. These are mostly targeted at wild boars and other smaller animals for bushmeat hunting. In these traps, the explosives are balled up with fodder such as cucumber or pumpkin and left in areas frequented by animals. Unfortunately, elephants also often fall victim to these devastating traps. This practice should be desisted, but it is becoming difficult to crack down as it is inexpensive and leaves no trace that can help to detect the responsible poacher. Except the officer holding the saline, other team members moved away from the elephant. Suddenly, the elephant was revived and turned angrily towards the officers. Maybe he's getting angry for pricking him with the needles. After being revived, the elephant slowly moved towards the thicket. With all the necessary treatment provided, there's no doubt about the recovery of the elephant. But he needs further treatment to fight the infection. The officers will trace him for that. Luckily, the explosion hasn't caused any major fraction or dislocation of the molar. It won't be too difficult to restore this injured mouth to a healthier state. Let's all wish him a speedy recovery and bless him to become a masterpiece of nature.